My name is Michelle Kaluwat, and I'll be presenting to you the pro-life stance on abortion. Abortion affects many people, and yet it's rarely talked about. I myself have friends who've gone through difficult pregnancies and friends who have been impacted by abortion. It is important that we discuss this topic and understand what abortion really is. Facing an unplanned pregnancy can be very difficult. Often the circumstances surrounding a pregnancy are difficult. Here are the most common reasons why women choose abortion. It could be because of rape or sexual assault. It could be because the mother is too young or too old. Maybe because it's financial reasons. Or maybe the child is diagnosed with a disability. It could be because of health problems with the mother or the child. Or maybe the mother is in school or she has a really good job. Or maybe they're simply not ready to parent or raise a child. Regardless of your stance on abortion, we can all agree that these situations are difficult. Let's take poverty as an example. Imagine we have a toddler named Mara, and let's say when her mother was pregnant to her, the mother is financially stable. But after a year or two of giving birth to Mara, she became unable to work and then eventually became poor. Would it be okay for the mother to kill toddler Mara because of poverty? What if the mother became poor when Mara was still an infant and Mara was only outside the womb for a few months? Would it be okay at that age, at that point, to kill infant Mara because the mother is poor? If it's not okay to kill a born child because of poverty, then we have to ask ourselves, why would it be okay to kill pre-born Mara for the very same reason? Or what about the horrible case of rape? Rape is a horrible crime, and we need to love and care for survivors of sexual assault. The rapist should be punished. Now imagine for a second that we have a woman who got pregnant because of sexual assault. Let's say that she's decided to keep her baby, but after giving birth to a baby boy, that baby boy starts to look more like the father. And now the mother is having a hard time raising her son. Would it be okay for her or for anyone to kill that baby boy because of who the father is, because of the father's crime? If it's not okay to kill a born child because of who the father is, because of the father's crime, then why would it be okay to kill that same child inside the womb for the very same reason? In Canada, we don't give the death penalty to the guilty rapist. How is it fair that we would give the death penalty to the innocent child? There are two innocent victims that we need to consider, mother and her preborn child. Both of them deserve our love and our support so that they can overcome a very difficult situation. Now we can all agree that killing innocent human beings should never be a solution to difficult circumstances. However, what many people don't agree with when discussing the abortion issue is whether or not preborn children are human beings. And so that's the key question that we need to answer. Who are the preborn? Are they human beings or not? Think about it. If a preborn child is not a human being, then there's no reason to oppose abortion. Abortion should be okay throughout all 9 months of pregnancy for any reason. However, if a preborn child is a human being, then there's no reason that could make abortion okay. There is no reason that could make it okay to kill an innocent human being. And so that's the key question that we need to answer. Now, a lot of people would say that preborn children aren't human beings because they're just a fetus. Now, I agree that the preborn child from 8 weeks until the end of pregnancy is called the fetus. The question is, what species fetus are we talking about? Because you can have a dog fetus, an elephant fetus, or a dolphin fetus. The word fetus doesn't tell us what species a being is. It tells us how old a being is. The word fetus, when you translate it from Latin, it means offspring or young one. The word fetus is an age range term like words infant, toddler, or teenager. And these terms tells us how old a being is. If you want to know what species a being is, or a fetus is, you simply ask the question, what species are the parents? If the parents are human beings, then the fetus or offspring must be a human being as well. Here's an ultrasound video of Noah at around 21 weeks. You can see him moving a lot, maybe sucking his thumb as well, and even kicking there. At around this age, Noah was able to feel pain, and he would have been able to survive outside the womb with medical technology. Here's Noah at an earlier stage at around 10.5 weeks. Did you know that around 3 weeks, your heart started to beat? And that around 6 weeks, you can detect brain waves through an EKG scanner. So we know that Noah is a human being inside the womb. More importantly, we know that his life began at fertilization based on science. We know that fetal Noah has always been a human being from the very beginning, from the moment he existed at fertilization. Here's a textbook definition of fertilization. I encourage you to check other biology textbooks or embryology textbooks, and I can tell you that you'll find something similar. It reads here that human development begins at fertilization, and this marks the beginning of each one of us as a unique individual. We know from science that life begins at fertilization, and it is a scientific fact. Here's a short clip of what human development looks like inside the womb in the first and second trimesters. If you would like to watch the full video, please go to ehd.org.
By 6 weeks, the cerebral hemispheres are growing disproportionately faster than other sections of the brain. The embryo begins to make spontaneous and reflexive movements. Such movement is necessary to promote normal neuromuscular development. A touch to the mouth area causes the embryo to reflexively withdraw its head. By 7.5 weeks, the pigmented retina of the eye is easily seen, and the eyelids are beginning a period of rapid growth. Fingers are separate. At 8 weeks, the brain is highly complex and constitutes almost half of the embryo's total body weight. Growth continues at an extraordinary rate. By 8 weeks, 75% of embryos exhibit right-hand dominance. Touching the embryo elicits squinting, jaw movement, grasping motions, and toe pointing. The fetal period continues until birth. By 9 weeks, thumb sucking begins, and the fetus can swallow amniotic fluid. At 12 weeks marks the end of the first third or trimester of pregnancy. Distinct taste buds now cover the inside of the mouth. By 24 weeks, the eyelids reopen, and the fetus exhibits a blink-startle response.
We know from science that preborn children are human beings. Now, there are people who argue that they shouldn't get human rights because they're very different from us. Now, it is true that there are many differences between preborn human beings and born human beings. When you look at these two photos, we have a photo of a human embryo around 8 weeks and a photo of Noah at birth. We can see that there are many differences. A preborn child is definitely smaller than a newborn baby. They're also less developed, they're in a different environment, and they're more dependent on the mother for survival compared to newborn Noah. There are many differences between a human embryo or a preborn child and a newborn baby. Now let's compare two other human beings. This is a photo of myself and my friend's son Micah. When you compare Micah to myself, we can say that Micah is much smaller than me. He's also less developed, and therefore he can't do as much as I can. He's also in a different location or environment. Micah lives in Ottawa and I live in Toronto. And Micah is very dependent on other people for survival. Think about it. If Micah was left on his own in a room with no one else, Micah would not be able to survive for a long time. And that's because he needs another human being to provide him his basic needs. Example, food and shelter. And so we can say that Micah is a very different human being from myself. Notice something interesting here? Those same differences are the differences we mentioned earlier when comparing a preborn human being and a born human being. Those differences exist amongst all human beings, amongst all of us. And those differences don't change who we are or what we are. It doesn't affect our humanity. More importantly, these differences boil down to one big factor, and that is age. Think about it. Why is the preborn child smaller than us? Well, how big do we expect them to be at that age? Why is a preborn child less developed? Why do they look funny? Why can't they think yet or do as much? Well, how developed do you expect a human being to be at that age? Why are they inside the mother's womb? Where else is a natural place for a human being to be at that age? And why are they very dependent on the mother for survival? How independent do you expect a human being to be at that age? Generally speaking, the more time you've had, the more developed you are, the older you are. The less time you've had, the less developed you are, the younger you are. All of these differences boil down to age. And finally, age, or any of these differences shouldn't matter when talking about human rights. Human rights should be for all human beings. Now you might be thinking, what about women's rights? What about women's choice? Now, as a woman myself, I value my rights and my freedom. I believe that women should be treated fairly and be given the same opportunities as men. However, the question is, can I use my freedom, can I use my rights to hurt or harm another human being? Think about it this way. I'm at the right age to drink. Can I go to a restaurant or a bar and grab a drink? Yes, I can do that. But could I get drunk and then drive myself home? No, that would be wrong. And that's because not only I would be putting myself in danger, but other people as well. We can all agree that my freedom to choose stops where other people's rights begin. We can all agree that I can't use my body to harm another human being. What does the choice of abortion look like? Notice that we have not really discussed or defined what abortion is. And we can keep talking about the abortion issue with a lot of very abstract words like my body, my choice, pro-choice or reproductive rights, or pro-life, human rights, or the right to life. However, in order to have an honest conversation on abortion, we need to know what abortion really is. We need to see what abortion does to preborn children. The next two videos I'm going to share with you explain what abortion procedures look like in the first and second trimesters. The videos are narrated by an OBGYN and also a former abortionist, Dr. Levitino. The videos are animated portrayal of the real abortion procedures. If it is hard to look at, hard to watch, you may close your eyes or look away. But I encourage you to watch the videos because I believe that you deserve to know the truth. Because it's important for us to understand what happens when we deny some human beings the right to life.
My name is Dr. Anthony Levitino. I'm a practicing obstetrician gynecologist and I've performed over 1,200 abortions. Today I'm going to describe a first trimester surgical abortion called suction D&C, dilatation and curettage. This is the most frequently performed abortion and is used typically from 5 to 13 weeks of pregnancy. After administering anesthesia, the abortionist uses a speculum like this. This is placed inside the vagina and opened using this screw on the side, allowing the abortionist to see the cervix, the entrance to the uterus. The cervix acts as a gate that stays closed for the duration of pregnancy, protecting the baby until it is ready for birth. The abortionist uses a series of metal rods called dilators, like these, which increase in thickness, and inserts them into the cervix to dilate it, gaining access to the inside of the uterus where the baby resides. The baby has a heartbeat, fingers, toes, arms, and legs, but its bones are still weak and fragile. The abortionist takes a suction catheter like this one. This is a 14 French suction catheter. It's clear plastic, about 9 inches long, and it has a hole through the center. It is inserted through the cervix into the uterus. The suction machine is then turned on with a force 10 to 20 times more powerful than your household vacuum cleaner. The baby is rapidly torn apart by the force of the suction and squeezed through this tubing down into the suction machine, followed by the placenta. Though the uterus is mostly emptied at this point, one of the risks of a suction D&C is incomplete abortion. Essentially, pieces of the baby or placenta left behind. This can lead to infection or bleeding. In an attempt to prevent this, the abortionist uses a curette to scrape the lining of the uterus. A curette is basically a long-handled curved blade. Once the uterus is empty, the speculum is removed and the abortion is complete. The risks of suction D&C include perforation or laceration of the uterus or cervix, potentially damaging intestine, bladder, and nearby blood vessels. hemorrhage, infection, and in rare instances, even death. Future pregnancies are also at a greater risk for loss or premature delivery due to abortion-related trauma and injury to the cervix. Today I'm going to describe a second trimester surgical abortion called dilatation and evacuation, or D&E. A D&E is performed between 13 and 24 weeks of pregnancy. After administering anesthesia, the abortionist uses a weighted speculum, like this one, that opens the vagina widely. Because second trimester babies are so large, this greater access facilitates a late-term abortion. Late-term abortion requires that the cervix be prepared 24 to 48 hours in advance with laminaria. Laminaria is a type of sterilized seaweed that absorbs water over 8 to 12 hours and swells to several times its original diameter. Once removed, metal dilators can be used to further open the cervix as needed. Once the cervix has been stretched open, the suction tube is placed inside. A baby at 20 weeks gestation is as big as the length of my hand, from head to rump, not counting the legs. The suction machine is turned on, and pale yellow amniotic fluid surrounding the baby is suctioned out through the catheters. With babies this big, they don't fit through catheters this size. The baby's bones and skull are too strong to be torn apart by suction alone. This is a Sofer clamp. A Sofer clamp is made of stainless steel. It's about 13 inches long. The business end is about 2.5 inches long and 1/2 inch wide, and there are rows of sharp teeth. This is a grasping instrument. When it gets a hold of something, it does not let go. The abortionist uses this clamp to grasp an arm or leg. Once he has a firm grip, the abortionist pulls hard in order to tear the limb from the baby's body. One by one, the rest of the limbs are removed, along with the intestines, the spine, and the heart and lungs. Usually the most difficult part of the procedure is extracting the baby's head, which is about the size of a large plum at 20 weeks. The head is grasped and crushed. The abortionist knows he has crushed the skull when a white substance comes out of the cervix. This was the baby's brains. The abortionist then removes skull pieces. He removes the placenta and any leftover parts of the baby with a curette, scraping the lining of the uterus for any remaining tissue. The abortionist then collects the baby parts and reassembles them to make sure that there are 2 arms, 2 legs, and all the pieces. Once all the parts have been accounted for, the abortion is complete. For the woman, this procedure carries a significant risk of major complications, including perforation or laceration of the uterus or cervix, with possible damage to the bowel, bladder, and other maternal organs. Infection and hemorrhage can also occur, which can even lead to death. Future pregnancies are also at greater risk for loss or premature delivery due to abortion-related trauma and injury to the cervix. As I mentioned at the beginning, I'm Dr. Anthony Levatino, and in the early part of my career as an OBGYN, I performed over 1,200 abortions. One day, after completing one of those abortions, I looked at the remains of a preborn child whose life I had ended, and all I could see was someone's son or daughter. I came to realize that killing a baby at any stage of pregnancy for any reason is wrong. I want you to know today, no matter where you're at or what you've done, you can change. Make a decision today to protect the preborn. Thank you for your time.
I will no longer do any more abortions. When you finally figure out that killing a baby that big for money is wrong, that it doesn't take you too long to figure out it doesn't matter if the baby is this big or this big or this big or maybe even this big, it's all the same. And I haven't done any since then, and I never will.
This is the reality of abortion. Abortion kills 300 babies every single day in our country. It is legal through all 9 months of pregnancy for any reason or no reason at all. Abortion kills innocent human beings. It's not just an abstract concept or a nice sounding word. Not only abortion takes away innocent lives, but it also hurts countless women and men who've had an abortion. We need to remember to share that truth with love and compassion. We need to remember that while we have to condemn the action of abortion, we have to show love to those who have been wounded. My friend Angelina had an abortion when she was young because of sexual assault. She was told that abortion was no big deal, that abortion would fix all her problems. Angelina did not know what abortion looked like, and no one told her the truth of abortion. After the procedure, Angelina suffered for many years, for 14 years. She felt a lot of emotions that she could not understand. She became addicted to drugs, alcohol. She had a lot of sexual partners, and she became suicidal at some point as well. She was trying to numb herself and run away from the feelings of grief, emptiness, and guilt. The abortion did not heal her from a trauma of sexual assault. The abortion created a different trauma in her heart, and that followed her longer. Years later, with her husband now, she got pregnant, and unfortunately that baby died because it was an ectopic pregnancy. And as Angelina was mourning over the death of her son, she started asking questions about her first pregnancy. She asked questions like, if this was a child, what about the first one? She eventually faced the truth honestly of what had happened to her first child, her first baby. And as part of her healing process, she named her Sarah Elizabeth. Angelina shares her story publicly to everyone today to prevent other women from going through the same experience. Abortion creates a cycle of pain, and we need to do better than abortion. Imagine you have a friend who has a 1-year-old, and let's say she's really stressed out and thinking of killing her child. How would you respond? Would we ever offer to help her kill her 1-year-old because the situation is hard? We would never consider killing born children a solution to difficult problems. So why would we ever offer to help a friend kill her baby inside the womb? Abortion kills children, and it hurts many people. Abortion doesn't solve problems. We need to provide real solutions to women who are facing difficult pregnancies. As you've seen, abortion kills children. And we need to share that truth with love in order to save children and spare women the trauma of abortion. Thank you for watching.